to Public Health Grand Rounds. We have a very special talk today by our CDC EIS officer, Dr. Allison James, on the alpha-gal syndrome. I want to give you a little bit of background about Dr. James as she's, before she come to us today. She received her Bachelor of Science degree from Michigan State University in zoology in 2005. She then went on to complete her studies, earning a Master of Public Health and a Doctor of Veterinary Medicine from the University of Minnesota and Michigan State University, respectively. As if that was not enough, she went to earn a PhD in immunology and infectious diseases from Washington State University, where she completed that in 2016. She is currently our EIS officer assigned to the Department of Health, a position that she's been in since July of 2019, where she is using this as an opportunity to have her complete her fellowship in applied epidemiology. She's been very involved with the COVID-19 response, pandemic response. Some of her past appointments have been a clinical assistant professor at the Paul G. Allen School of Global Animal Health at Washington State University. She has done some international work with the International Food, Animal, and Public Health Externship in Bangkok, Thailand. She has completed several or been a part of several peer-reviewed publications. More recently have been involved in the SARS-CoV pandemic, where she has published several times in the MMWR and in the very prestigious New England Journal of Medicine. She has a wealth of teaching and instruction experience, again, from Washington State University and others. And she has been involved in several presentations nationally and internationally, and we are so excited to have Dr. Allison James here to talk about alpha-gal syndrome. So please help me welcome Dr. James.
Okay, thank you for that very thorough introduction. So I'm going to talk to you today about alpha-gal syndrome. This is kind of an interesting project, but where I want to start is really to talk a little bit and put a shameless plug in for the Epidemic Intelligence Service program. So as was said in the introduction, I am an Epidemic Intelligence Service Field Officer, and so essentially this is a two-year applied fellowship, or two-year fellowship in applied epidemiology, and it's run through the CDC, so I am officially a CDC employee at the time. I started in 2019, so I only have 8 months left in this fellowship, and it's kind of crazy, but I was very fortunate to come to the Arkansas Department of Health for my fellowship, because immediately after arrival, I just was thrown into just so many interesting experiences, like the vaping investigation and Legionnaire's outbreaks and TB work and lots of COVID work. And so the breadth of experience has really been a rewarding experience for me. But the very, very first thing that I got involved in was being involved in the alpha-gal position statement. And so I want to talk to you about that work today, but step back a little bit and also talk about the clinical features of alpha-gal syndrome, explain how sensitization to alpha-gal occurs and how this relates to AGS distribution, and then go into some of the nuts and bolts of that proposed case definition. To do that, I'll start with a background. So what is it? How was it discovered? How does it happen? What's it look like? How do you treat it? What's the scope of the problem? And then the spoiler here is really we don't know a lot about the scope of the problem. And then, again, go over that alpha-gal syndrome position statement. So let's start with what is it? I'm going to give you a brief overview of alpha-gal and then go into the details. So alpha-gal is a sugar molecule, It's short for galactose alpha 1,3 galactose. And it's found in the tissues of cattle, pig, sheep, deer, and other mammals, and mammal-derived products such as gelatin or dairy products. It is not found in humans, old world monkeys, and great apes, and it's not found in non-mammalian animals such as fish, birds, and reptiles. So the image here is a depiction of the molecule of alpha-gal, and one thing that's important to point out is that it's very similar to the blood group B antigen. This blood group B antigen the B-like antigen, which is now known as alpha-gal, was discovered 100 years ago and is a known xenotransplantation barrier and has been known for quite some time. So then what is alpha-gal syndrome? Alpha-gal syndrome is an immune globulin E-mediated hypersensitivity reaction to that molecule. The unique feature of alpha-gal syndrome and what separates it from other classical food allergies is that it typically occurs 3 to 6 hours after ingestion of mammalian meat. And there is a very high range of possibility as far as clinical symptoms and clinical presentation that patients can have. So the reaction can range from hives to anaphylaxis and may include only in gastrointestinal symptoms. And we'll talk a little bit more about that later. But I want to take a step back and talk a little bit about how it was discovered, because the way that it was discovered and the way that this was all tied together is just a fascinating story, I think. And so let me take a minute to describe that story. So beginning in 2004, oncologists were describing these acute, severe hypersensitivity reactions in metastatic colorectal cancer patients who received the drug cetuximab. Cetuximab is a monoclonal antibody. At the time, it was in the clinical trial phase. And the drug was used to treat these patients with metastatic colorectal cancer. What was interesting about these reactions is that patients were getting these severe hypersensitivity reactions at their first infusion, but they were also in seemingly only mid-south states at the time. So it was Tennessee, North Carolina, and Arkansas is where a lot of these patients were being identified. And when oncologists were talking to their counterparts in more northern states, they weren't really seeing these hypersensitivity reactions. And so that was kind of a first clue. So by 2006, it was clearly demonstrated that the cetuximab-specific IgE was circulating in reactive patients before their infusion, which was already suspected at the time. So cetuximab, or Erbitux, is a chimeric mouse-human monoclonal antibody. And so soon investigators discovered that the specific epitope of these IgE-mediated responses was in the FAB portion of the antibody, which is also the mouse-derived portion of the antibody. And so now, even though we have identified the epitope leading to these hypersensitivity reactions in cetuximab, at the time we didn't know that it was related to alpha-gal syndrome. And so cetuximab has now been approved for the use of metastatic colorectal patients and also for squamous cell head and neck cancers. And now there's a warning on the label, and it suggests something like this could cause severe hypersensitivity reactions in patients that have alpha-gal syndrome or a reaction to alpha-gal. And so I think that's kind of an interesting tidbit. So during the early 2000s, around the same time, and actually in some cases involving the same allergists that were involved in this cetuximab mystery, clinicians were starting to evaluate more and more patients that had these recurrent episodes of urticaria or anaphylaxis, and they were being reported after consumption of meat in the 3 to 5 hour period prior. And so that was, again, unusual because most food allergies, the reaction is more immediate. And so when investigators started digging into this, they found that there was a similar unpublished phenomenon described in 1991 at the Georgia Allergy Society annual conference that described this cluster of people that had this delayed onset of hypersensitivity following the consumption of meat. Interestingly, those investigators went a step further, and they were the first to kind of describe this tick connection, in saying that most, if not all, of the patients in that cluster ended up having tick bites in the months or weeks preceding their first episode. So within the first few years, the cetuximab findings and the meat allergy investigations were linked. So first, it was known that the cetuximab hypersensitivity reactions were directed towards this alpha-gal epitope, and that this epitope is this bee-like oligosaccharide, a known xenotransplantation barrier that's found on non-primate red blood cells. And so that really provided a clue for which antigen to look at for these red meat allergies. The distribution of cetuximab reactions also overlapped the reported red meat allergies, the distribution of patients with red meat allergies, and the maximum density of Rocky Mountain spotted fever. And so again, pointed to this notion that there could be a shared antigen here, but also that there could be a tick connection. And then finally, patients with red meat allergies did in fact commonly report tick bites in the months or weeks leading up to their first episode of anaphylaxis. And then they also had this elevated IgE that was specific to alpha-gal. And that was, interestingly, using the same assay that was developed for cetuximab. And so now we have this story where everything is linked. Cetuximab is linked to red meat allergy, to alpha-gal, and to tick bites. So now that I've talked about how the connections were made, I'll talk a little bit more about how alpha-gal syndrome develops and where. So tick bites are the essential risk factor for the development of alpha-gal syndrome. So what we know to support this is that the Lone Star tick saliva contains the alpha-gal moiety. There's only one other tick in the United States that's known to possess this alpha-gal moiety in its saliva, and that's the black-legged tick. And there's some debate in the literature about the role of the black-legged tick in precipitating alpha-gal syndrome. Many allergists believe that they're not involved in sensitizing patients to alpha-gal. We also know, in support of this connection with ticks, that after a tick bite, people will get an increase, a 20-fold increase in alpha-gal specific IgE. And that this effect is cumulative. And so the more tick bites you have, the more and more your IgE will increase. And that's particularly true in patients that are sensitized. Correlating with alpha-gal specific IgE is also the increase in IgE to whole tick extract. And so that was a pretty strong connection that, yes, tick bites are in fact the precipitating event to sensitization. And then finally, most alpha-gal syndrome patients have a history of known tick bites. One bite is thought to be sufficient for sensitization, but multiple bites certainly increases the sensitization risk. So at this time, even now, we don't have very good epidemiological data, but this is one of the first maps that was put out for sort of the distribution of alpha-gal syndrome. And this map was put out by USDA Beef Research. And what they did is they looked at data from about 7,300 specimens that were submitted to a reference lab, and they looked at percent positivity by region. And overlaid on this map is a white kind of checked area, and that is the distribution of the Lone Star tick. And what they showed very clearly is that the percent positivity was much higher in South and Mid-South states where the Lone Star tick was known to be abundant. So what does it look like? Alpha-gal syndrome can present in a number of different ways, which makes this a real diagnostic challenge. So a typical scenario is that somebody 3 to 6 hours after ingestion of an animal product, specifically a mammalian animal product, or immediately after parenteral administration, IMIB or sub-Q administration of an alpha-gal containing product, a patient will develop a range of symptoms from gastrointestinal pain, nausea, diarrhea, vomiting, to more classic anaphylactic symptoms like hives, itching, swelling of the facial structures, lips, throat, tongue. Also breathing problems like wheezing, shortness of breath, and then acute episodes of hypotension, which can be particularly dangerous. But Dr. Commons, who's sort of the leading subject matter expert on this syndrome, coined the phrase consistently inconsistent, and that's almost a hallmark of AGS diagnosis. And I like that, consistently inconsistent. And there's a lot of factors that go into why it's consistently inconsistent. So again, there's this cumulative effect. So the longer somebody goes and is exposing themselves to alpha-gal unknowingly probably, because they're consuming meat or consuming animal products, or because they continue to have tick bites, the less time in between symptoms and more severe those symptoms can be. Other factors that might increase the severity of symptoms include the co-consumption of alcohol, nonsteroidal anti-inflammatory drugs, and then exercise. So if you exercise after a meal. And all of these things are thought to be mediated by digestive processes. So the timing, the delay of alpha-gal syndrome is thought to be related to the delay in digestion in the small intestine and then delayed antigen presentation to the gut. And so those cofactors like alcohol, nonsteroidal anti-inflammatories, and exercise can increase gut motility and speed things up. People that have consumed alpha-gal, they are much more likely to have gastrointestinal symptoms. But people that consume it can also only have hives or respiratory issues or hypotension. And so again, that variability, consistently inconsistent. However, people that do have parenteral administration, they do tend to have those classic immediate hypersensitivity reactions, and that makes sense. So what are the food products that contain alpha-gal? Well, meat, obviously, beef, pork, and lamb. There's kind of a range of the levels of alpha-gal in these products, and it's unclear why, but it seems to be that people are sort of sensitive to those products, beef, pork, and lamb, in that order. Seems like more people are sensitive to beef versus pork versus lamb. And then some people can consume dairy products, but some people can't consume any dairy products. Some people can consume skim dairy products only, but not fatty products. So it's known that fattier products can be more of an issue for precipitating an alpha-gal reaction. Some people are so sensitive to meat that they are sensitive to the vapors. So if somebody's in a room cooking, they cannot be in the room or they can have an anaphylactic event. Medications like antivenoms and heparin also can be a problem for people that are sensitized. Some vaccines like shingles, MMR, rabies, varicella, and yellow fever vaccines, these vaccines have gelatin and it's used as a stabilizer in the vaccine. And so while most people can receive vaccines with no problem, there are some people that are sensitized to alpha-gal that cannot receive these vaccines without an anaphylactic event. Xenotransplants, this is somewhat obvious, but porcine and bovine heart valves can also precipitate an event. For diagnostic testing, there are qualitative tests and there are quantitative tests. So the qualitative tests are going to be those traditional skin tests, those prick tests or intradermal tests. There's some sensitivity issues with these tests, especially with alpha-gal syndrome. And it's, there's host factors, obviously, that might play into whether or not somebody, produces a response to those skin tests. But there's also varying levels of the actual alpha-gal molecule and some of the extracts that are used. And so for the extracts that are used, kidney, for example, is known to be more sensitive or produce more reactions because it's known to have more alpha-gal in it versus a commercially prepared meat extract. So there are some sensitivity issues with those qualitative tests. But what would be sort of a traditional finding for alpha-gal syndrome is a person that is positive for beef, pork, and lamb, and negative for chicken and turkey. Quantitative tests, so this is kind of the new, I mean, when I say new, I mean in the last 5 to 10 years. And these tests measure serum IgE specific to alpha-gal. And these tests are actually becoming widely available. There's one main laboratory that runs these tests, but reference laboratories like Quest and LabCorp have a code to order these tests too, so they're fairly widely available. The problem with these quantitative tests is that they cannot distinguish someone that is asymptomatically sensitized to alpha-gal versus somebody that has alpha-gal syndrome. And then one word of caution about these tests is that it's unclear and seems unlikely that the titer of somebody's IgE specific to alpha-gal relates to or predicts the severity of their clinical symptoms. And then finally, there's another sort of test on the horizon, and that's the basophil activation test. And this test is showing some promise because it can distinguish between people that are, asymptomatically sensitized and those that have alpha-gal syndrome. Okay, so how do you treat it? So I have here medications and then kind of long-term treatment, but somebody that's in an acute anaphylactic event needs care and circulatory support and epinephrine possibly. So that's the kind of the acute crisis. But for management, the medications used are antihistamines, oral corticosteroids, sort of the traditional allergy medications. But oral cromolyn and omalizumab have also been used with some success. So oral cromolyn is used as a mast cell stabilizer for inflammatory bowel disease patients. And that has been used in success with patients that just continue to react or for whatever reason don't seem to be desensitizing when avoiding alpha-gal containing products. One interesting thing about cromolyn is that many patients have already been on cromolyn because they have these undiagnosed alpha-gal syndrome cases for so long and they have kind of chronic GI issues, and so they've already received a diagnosis of inflammatory bowel disease. Omalizumab is another drug that is being used with some success, and that is to treat chronic urticaria and asthma. And that's kind of a newer finding out in the literature just in the past year and a half. For long-term treatment and management, the mainstays of treatment for alpha-gal syndrome are avoidance of tick bites and avoidance of the allergen. So food avoidance diets. And this is actually kind of a challenge for people. So one thing I was reading when I was doing research in this is that first of all, there's no labeling requirements for alpha-gal. So even though this syndrome is kind of increasing and becoming increasingly recognized, there's no requirement to label alpha-gal containing products. Products that are problems for people are sort of those hidden ones like natural flavorings that can be animal derived and contain alpha-gal, but you have no idea what they are because it just says natural flavorings on the package. Another one that I find really interesting is chicken and turkey sausages. Those are made with chicken and turkey, but the casings are made from pork gut in many instances, not always, but in many instances. And so people will still have reactions because they're, not truly avoiding alpha-gal. So what's the scope of the problem? What do we know? The answer is really relatively little. I'm going to show you a bunch of slides here that really, unfortunately, aren't that informative, but it's what we have at the time. So the geographic distribution is that it's reported in 17 countries from 6 continents. No doubt that this list is underrepresented as far as where alpha-gal syndrome actually is, because again, it's a new syndrome. It's increasingly being recognized, and so no doubt in the next couple of years that list will expand. This was data collected by some of the CDC subject matter experts. they acquired the testing data from one of the main commercial labs, or the commercial lab, really, that runs the serum IgE test. And they found that of those submissions, about 40,000 of them would be considered positive when looking at the clinical symptoms in combination with the serum IgE. So at least 40,000 cases have been diagnosed in the United States thus far. And again, this map just overlays sort of those hotspot areas, with the bright red being greater than 100 cases, the light blue being 41 to 99 cases, and the dark blue being 5 to 40 cases. And you can clearly see on this map that the sort of the highest burden as far as case counts is in areas that overlay the distribution of the Lone Star tick, which is in red here. Another interesting finding out of this study is that the submissions, so the demand for the test, is increasing year after year after year, and that the number of diagnoses has increased 81 times from 2010 to 2018. So again, another map just kind of showing and underscoring again that the distribution and the burden of alpha-gal syndrome seems to fall in the Mid-South and Southern states. So this is self-reported residents of AGS patients where they live. They also self-reported their alpha-gal syndrome too. So definitely a trend. So in 2016, Dirk Haselow asked those same labs to give the Arkansas Department of Health the data specifically from Arkansas. And what he did is he looked at the distribution of those cases by residents. And so there were 627 persons that were tested using the serum IgE test between January 2013 and September 2015. And of those, 270 were positive. And when he mapped it out, it clearly shows a distribution in the northwest corner of the state. And then again, this is just showing the case counts of those 270 positive patients. More than half of them, or roughly half of them, were in Washington and Benton counties. However, I want to point out that we do have some very kind of aware allergists in that region of the state. And so some of this could be testing bias. The ages of those 270 patients were just across the board. So from infants less than a year of age to people that were very elderly. And then finally, I put this map up here just to sort of hone in on this distribution of ticks in the state. So a University of Arkansas researcher initiated this citizen science project 2017 and 2018, and they asked citizens around the state to submit ticks. And the idea of the project was to look at the distribution of ticks around the state, but also to look at tick-borne diseases. And so I present here only sort of the data on the distribution of the tick, and you can clearly see, and all of us know from being outside in Arkansas, that Lone Star ticks are very abundant in the state of Arkansas. The red dots are the Lone Star tick. But they're increasingly abundant in the northwest corner of the state. And if you overlay this map and the previous map from Dirk Haselow, it very much correlates to where we see the greatest burden of ehrlichiosis. So finally, in Arkansas, alpha-gal syndrome was enough of a problem that in 2015 there was the creation of an alpha-gal task force in the state legislature. And this came about out of increasing public awareness, but also because a couple of legislators actually had alpha-gal syndrome themselves. And so the idea of the legislative task force was to really promote awareness, so increase provider awareness, EMS awareness, make sure everyone knows about these acute anaphylactic events, and also hopefully to get better awareness for treatment for these patients that are suffering. One thing that the task force did is they submitted this resolution to amend the Food Allergen Labeling and Consumer Protection Act. And Dr. Wheeler tells me that they actually did send a team of representatives to Washington, D.C. to meet with the FDA to talk about amending this act. And it turns out that it's a very difficult process to amend the act, and it would take an act of Congress. And so, unfortunately, at this time, no changes have been made to the labeling laws in regard to alpha-gal. But that information is on the Arkansas Department of Health website for people that are interested. So in summary, there's really no good estimate of burden or distribution. So all the data I've shown you here is, it's not very powerful or compelling. And so what we really need is we need a better understanding of what the burden of this syndrome is. No doubt that part of those issues are related to underdiagnosis of this syndrome. So there's a variable clinical presentation, which makes this, again, a diagnostic challenge. There's hidden sources of alpha-gal. So one of the mainstays of diagnosis is avoidance, and then, resolution of symptoms as being sort of an indicator that a person is sensitized. But if a person can't really avoid alpha-gal, that becomes a challenge. And then there's lack of physician awareness. So no doubt that this is an underdiagnosed and underreported condition. There's also no standardized case definition, which is, again, what I've been working on. But we really need that to collect comparable clinical, laboratory, and epidemiologic data. States, so Arkansas is definitely a state that would be interested in adopting this case definition among a number of other southern and mid-south states. But one of the main benefits of it is that if we really can characterize the burden of alpha-gal syndrome and tick-borne diseases in general, then we might be able to promote more public health programs for tick control and prevention, tick bite prevention messaging. So now I'm going to take a couple minutes and take a step back and talk about the proposed alpha-gal syndrome position statement, which is the standardized case definition. And the purpose of this is really to characterize the spatiotemporal distribution of alpha-gal syndrome and to allow the quantification of the burden of the disease. The standardized case definition allows for comparability of data across jurisdiction. And I just want to be clear that this is not a recommendation to require national notification. So this, if adopted, this case definition would be voluntarily adopted by states and used for their surveillance programs. There are at least 10 states that have expressed interest in adopting this. But of course, in the time of COVID, it's very difficult to think about taking on something else. So we'll see. So the nuts and bolts of this position statement is that where alpha-gal syndrome is reportable, laboratories, clinicians, and outpatient clinics would report based on laboratory criteria. And that laboratory criteria is a patient that has serum IgE specific to alpha-gal greater than that reference level, which is 0.1 IU per mil. They would also report any person that has an allergy skin test that's consistent with alpha-gal syndrome. So positive for beef, pork, and lamb, negative for chicken, turkey. Now for the case definition, the laboratory criteria would be a person would have confirmatory laboratory evidence if they have that serum IgE test that's considered positive. And they'd have presumptive laboratory evidence if they had an allergy skin test consistent with alpha-gal allergy. For the clinical criteria, this would be the acute onset of symptoms that occur 2 to 10 hours after ingestion of pork, beef, lamb, or any other mammalian meat or mammal-derived products, or within 2 hours after IM, IV, or sub-Q administration of an alpha-gal containing product. And those symptoms include this list. So it's an or list. So a patient could have one of these symptoms and have laboratory evidence and might be considered a case. So the symptoms are abdominal pain, nausea, diarrhea, vomiting, hives, itching, swelling of one or more of the following: lips, tongue, throat, face, eyelids, or other associated structures. shortness of breath, cough, wheezing, an acute episode of hypotension, and the absence of an alternative diagnosis. And the little asterisk on hypotension is because we account for variable normal levels of systolic blood pressure in patients of different ages. So for case classification, a confirmed case would be somebody that meets the clinical criteria and has confirmatory laboratory evidence. So confirmatory laboratory evidence is the serum IgE test. So this might be somebody, for example, that ate a pork chop 5 hours ago, and they have abdominal pain and hives. And they have that serum IgE test suggesting that they have alpha-gal syndrome. It could also be somebody that received a zoster vaccine 30 minutes ago and is having an acute anaphylactic event and has a serum IgE test consistent with alpha-gal syndrome. A probable case is going to be somebody that meets the clinical criteria and has presumptive laboratory evidence. So remember, presumptive is the skin test. So this is going to be somebody, for example, that ate beef jerky 9 hours ago, and they went to their allergist and they got a skin test that showed an alpha-gal pattern. And then a suspect case is going to be those that meet confirmatory laboratory evidence with no clinical information available. So from the public health standpoint, this is probably going to be those cases that are reported by the laboratory, but for which the jurisdiction did not or cannot obtain the clinical information from the patient. So where are we with this case definition? On Monday, I presented this to the executive board, and they will be voting on it, I believe, in the next week. And so hopefully we will have a case definition for alpha-gal in the coming weeks. And if it is adopted, I've already mentioned Arkansas is one of the states that's very likely to include it on its reportable condition list. So in conclusion, I hope that you take away from this that alpha-gal syndrome is a life-threatening, under-recognized condition. There's been significant advancements in the knowledge of alpha-gal syndrome sensitization, immunology, diagnosis, and treatment, but what we're still lacking is good epidemiological data. And then finally, adoption of a position statement will better characterize the overall burden and distribution of AGS in the United States. So with that, I would like to thank Dr. Laura Rothfeld, who's the Arkansas State Public Health Veterinarian, and Dr. Suzanne Beavers, who is the CDC Epidemiology Workforce Branch, my Epidemiology Workforce Branch supervisor, who provided some positive feedback on this presentation. And Dr. Rothfeld was also a member of the alpha-gal position statement working group. And the names are listed here, but I want to, in addition to Laura, I also want to specifically thank Paige Armstrong, Kristen Nichols-Heitman, and Scott Commons, who are the subject matter experts on our committee and who were a joy to work with. I learned a lot from them and really appreciated my experience doing this. So the references for those that are interested are listed here. I'm happy to provide them later. And with that, I will take any questions.
I guess I don't have so much a question as more a sharing of my alpha-gal ignorance story. When I moved back to the United States from Honduras about 4.5 years ago, a little time after that, I reconnected with a childhood friend who lives in Northwest Arkansas, and he started telling me about this story that he's now allergic to beef. And I was like, and I knew this guy growing up, he used to eat beef. I was like, what? And he started telling me about alpha-gal and realized, this is just so strange, right? Medically, it's this weird and very strange phenomenon about how it develops and how it got connected and how long's it been around and we just didn't recognize it, or is it's a truly new thing? I mean, this is just strange. When I was in medical school, graduated in 2005, never heard of it. Residency through 2008, never heard of it. And then I came back, 4.5 years ago, and it's this thing people are suffering from. So, I think it's just really weird. And interestingly, this friend lives in Northwest Arkansas, spends a lot of time outdoors, and indeed in the years prior to his diagnosis had bought a tract of land in the mountains in southern Washington County and was building a house. So he was out in the woods, every weekend, all weekend long. And so I just think it's the most interesting thing. Thinking back, in the couple of years after that, as I was in the clinic, I had a couple of patients who had been diagnosed with it, but I started thinking, like, how many people have I seen as a primary care doctor that, they got urticaria. We don't know why they got urticaria. There's no clear, obvious reason. The things you usually ask about aren't things you had 6 hours before. You don't think of meat as a primary care doctor. It's pretty challenging, but I think you're right. As more people know about it, more people think about it, more people consider it and then test for it, and hopefully, it's a big deal for some people. Do great with can't eat meat. Okay, fine, they just get rid of it. But other people, that's like a major life-changing decision for them. And then you have the issues of labeling and not really knowing what's in stuff, and some people are more sensitive than others, and some people, I've got a nephew who's got, not alpha-gal, but other significant childhood allergies, right, to all kinds of foodstuffs. And like my brother and his wife had to completely change their life. Like she had to be so careful, especially early on. He's gotten better, but my goodness, like the lengths that families have to go to for things like this are pretty incredible.
Yeah, thanks for that. It's
Dr.
consistently inconsistent. I like that.
Thank you.
Sure.
2 issues. One will go to Dr. Wheeler. Long term, you've talked about avoidance of allergens. Would you be bold enough to promote a vegetarian diet? Or you fear the meat industry?
The latter. No, I don't think that based on alpha-gal alone, I would. Of course, for somebody that's sensitized, I would. But I don't think for the average person, I don't think we're at that level yet where I would promote a vegetarian diet for the population as a whole.
Yes, but what I feel is that this is an evolutionary problem. I'm wondering about lactose and alpha-gal and other things which we may be able to predict using quantitative methods, serum, and they are saying the challenge is that may not be predictive of who is likely to be so allergic. But I think as humans, I thought, we consume milk, and humans, NPR says, which is true, are the only mammals that consume other people's milk. So milk is an issue, but now meat is an issue. I don't know what to do. I will stick with the meat anyway. The next issue is vaccinology, Dr. Wheeler. Where are we moving away from these products, subtle additions, anything like that, to a vaccine line to avoid these problems? Because there you are really injecting something directly into a human, causing catastrophe.
Yeah, that's a good comment. The vaccination comment. I'll just say a couple words about that. Gelatin is one of those things that seems to be a minority of patients are sensitized to gelatin. And so, of course, there's an increased risk in somebody that has alpha-gal syndrome that, receives a vaccine that has gelatin in it. But the current thinking is that for most patients, that's going to be safe to continue to receive vaccinations under the close watch of a physician while receiving the vaccine. Yeah.
Yeah, I think the issue of vaccines that cause this syndrome is that data is just really emerging. There are clearly some papers where it's been documented, zoster vaccine or other things, that's an issue, but it is a minority. It's a big public health issue because a lot of these physicians who are very proactive about looking for IgE in the large number of children that have asthma or other allergic diseases are screening for this. And if they get a positive IgE, they want to excuse children from all vaccines. And so this has been a real problematic area for Dr. Dillahay in the immunization area, and I think we're still waiting to completely understand the full spectrum of vaccine sensitivity. In answer to your question, we change vaccines all the time. There was a scare about mercury, and we've removed vaccines. So I think that industry has the capacity to do that, again, if there's enough political pressure to do that. I wanted one quick clarification, then a question. The Group B isotyping for blood banking type isotyping, that is the Group B you're speaking of, correct?
Yes,
Yeah.
the blood type, yeah.
So just to clarify, do people who are B-type positive individuals get this or don't get this?
Yeah, so that's a really fascinating question. Less people that have group B type get this condition. And the thinking is because the molecular structures are so close that they're tolerant, to it. So certainly there has been cases reported that have AB or B type that have alpha-gal syndrome, but it appears that people with A or O blood groups are much more likely to develop alpha-gal syndrome.
So the question I was going to ask you, and I guess it's relevant to what Leonard asked, there's about 3 million people in Arkansas, and I suspect 2 million of them have had tick bites and eaten red meat in the in the last year. So from your PhD in immunology and infectious disease, we know that clearly there are genetic issues that predispose people to have IgE reactions in the first place that are broad, but also specifics for certain types of allergic substances. Did you see anything in your literature that would give us some hints about, is there work ongoing to identify what the genetic markers are for this type of hypersensitivity, and whether that's a potential screening tool as we move into the age of molecular diagnosis for patients?
Yeah, that's a great point. So I did not come across anything as far as host genetic markers. There is quite a body of work being done right now to understand why it is that a person gets sensitized after a tick bite as compared to ingestion. And the thinking is that it's a specific response in the skin with antigen processing, whatever that may be. There's a lot of hypotheses out there, but I have not seen anything in particular about host genetic markers. That's not to say that it's not happening. So before I move on to these comments, I do have a table up here. One of the papers that described the safe immunization of somebody with the Zoster vaccine kind of compiled this nice list of the gelatin content of vaccines. And it does appear that the vaccines that have more gelatin content, are the ones that produce more hypersensitivity reactions in AGS patients. So I just put that list here for your viewing pleasure. There was a comment from Jose Romero that consumption of natural cheeses containing ruminant rennet may also be a problem. So thank you for that comment. And then some questions. Is consumption of venison or other wild game safe? Have there been any deaths attributable to AGS? Consumption of venison and wild game has been associated with alpha-gal syndrome less commonly than kind of the normal meats like beef, pork, and lamb. But there certainly have been cases associated with really any mammalian meat. In Australia, kangaroo has been associated with alpha-gal syndrome. And have there been any deaths? Yes, there have. We don't have good data on how many deaths, but certainly some of the cetuximab patients, for example, some of them died, and there have been some severe anaphylactic events that have led to the death in alpha-gal sensitized persons. And then a question from Atul Kathari. The finding of increased alpha-gal IgE in Northwest Arkansas is quite striking. Any comments on the possible reasons? Yes. So let me start with tick abundance. So if you look at the kind of the maximum density of Lone Star ticks, and you look at the maps and where they overlay those maximum density of cases, it doesn't always correspond or correlate very well. And so it's really unclear whether it's just a tick abundance issue or whether it's a local provider awareness and testing issue. And I will say that one of the allergists in Northwest Arkansas was, one of the leading people on the cetuximab story and also on diagnosing alpha-gal syndrome. And so there definitely could be some diagnostic bias in Northwest Arkansas that's leading to more diagnoses as compared to other areas of the state. So those are just two things kind of off the top of my head. And then back to that tick notion, there have been some models that predict, as we know, in the last 10 years, the abundance of the Lone Star tick has increased in this area, but it's also kind of shifting to northern latitudes. And so there's been some modeling studies and some real-life examples where we do see alpha-gal syndrome sort of moving north and north and north. And there seems to be this interesting western wall where they're not really moving west because it's not moist enough for them there, but it seems to be moving up away from the Gulf Coast and more north. So, the distribution is likely to change.
Thank you. That was such an excellent presentation.
Thank you.
I really appreciate you taking. When I worked here and was involved with the legislative task force, correct that there was a single allergist necessarily pushing the diet, but testing every single patient. So anyone who might have a concern about this or any of the other allergists would refer them. Without a doubt, it is because of the awareness of this one allergist that there are so many cases diagnosed. And the second very minor point actually goes along with your skeleton content. Obviously, that's, something. Associated things. So you're
Right.
thinking,
Yeah.
some people are extreme.
Yeah.
At ADH, that employee was my.
Mm-hmm. Yeah, thank you. That's good institutional memory. So one thing when I was reading through the documents on the alpha-gal task force that I found to be pretty interesting is that some of the antihistamines are coated with gelatin. And so if somebody, is thinking that they're doing the right thing by, taking an antihistamine and then it's coated with gelatin, they might actually be worsening their problem. So.
Thank you for an excellent presentation. I'm still perplexed about almost everybody in Arkansas eats meat, and everybody in Arkansas has tick bites, and yet this is a very uncommon syndrome. And you could say, well, it's just underdiagnosed, but I don't think it's that much. And so already asked, is there a genetic susceptibility? But I was also wondering if we've looked at the saliva of a large number of ticks, perhaps some of the ticks don't have this alpha-gal in their saliva. That would explain it all.
Are you referring to some species or some life stages of the tick?
Well, the Lone Star tick, I don't know enough about.
Yeah, so all life stages of the Lone Star tick have alpha-gal in their saliva.
So they've looked at 1,000 Lone Star ticks and found it in 1,000 of them.
Yeah, it appears to be intrinsic to the tick saliva, because there was a lot of hypotheses about where does alpha-gal come from. Is it because they previously fed on, a mammal and there's some residual alpha-gal in there, and all these things. But what they ultimately found is that the moiety is in the saliva of the tick.
So, are there primates that have this alpha-gal in their tissues?
Some of the New World monkeys, they do not have this. How do I want to say it? So some of the primates do have alpha-gal in their tissues, but they're like the New World primates rather than the Old World, more human-like primates.
About humans?
Humans do not have alpha-gal in their tissues.
And look for extensively.
Yeah.
Okay, thank you.
Yeah. So I have a couple comments here from Jose Romero again. He said, you should mention that persons with severe alpha-gal syndrome should carry an EpiPen. Thank you for that, absolutely. And then another comment is that ACIP has issued a statement on vaccines in patients with alpha-gal, and I wish Dr. Romero were here in the room so he could tell us more about that, but I just don't know about that. Do you know about that, Dr. Wheeler?
I didn't know that the statement had come out. I knew that they were discussing it.
Okay. Okay. Yeah. Okay. Thank you. Appreciate your attendance.